Hello, this is Dr. Adam Kopsky from Advanced Rehab and Medical, and this is part two of the two-part series we're doing on pregnancy-related low back pain. And so once again, we got this going this week. If you want any more information on what I'm going to go into, be sure to come in and by the rehab station, and then up front at the front desk, you can see the handout. It's really good information that maybe you yourself are not pregnant or have had back pain during pregnancy, but I'm sure a friend or a loved one you know could be going through that. So be sure to grab that and ask us for any questions if you have any issues going on that you just want clarification about, because we are here to help. What I want to talk about today is just a few tips that really, if you remember last week, I was talking about the changes your body goes through when we actually are pregnant and we're gaining weight because we have another human that's coming in, and all our spine's going through changes, and then the muscles, ligaments, and tendons can all be strained and cause pain. So I'm going to just go over a couple tips and then show an exercise that you can do at home that can really help this, and maybe you can share it with a loved one if they're experiencing low back pain while pregnant. And so the first tip I want to go over is, if you remember me talking about last week, is a lot of the pain comes not because of your joints are not moving, or what we call hypomobile, but because they're moving too much. And so if you remember me discussing, things are moving, so that creates laxity. When we get laxity and too much movement, well, that can cause pain. And so one thing that's really helpful that we like to give our patients is a back brace. And not just one that goes around, actually a trochanteric or SI brace. And what that does is it goes right around your hips here and then attaches right on the SI joints right here to really keep that stable. So you want to make sure while you're pregnant, especially in the second or third trimester where the pain is typically at the worst, to really stabilize that. The other thing is heat versus ice. And so they've actually found studies that heat has actually been shown to raise the mother's body temperature and can cause, on rare occasion, fetal malformations. So if you go to any other doctors and they're recommending putting heat on that pain, please avoid that. It probably won't cause any harm, but just to keep your mind at ease and err on the side of caution, do ice. Anything cold, biofreeze does wonders. So anything cold is what you want to go by on that. The other thing is modalities. So in here, if we do a lot of ultrasound, cold laser, E-stim, you want to err on the side of caution and never use those, because the sound waves, laser, cold light can disrupt the fetus and the embryo when it's growing. So you want to avoid all kinds of therapies there and just go to ice and a brace. So the last thing I want to discuss real quick is a simple exercise. So what I'm going to do here is to work on the stabilization of the glutes. So one thing here is we call a dynamic wall squat. So at home, if you step 6 inches away from the wall, all you'll do is just squat down right until your butt touches the wall. Very simple. If you do about 3 sets of 10 of these, try to aim for twice a day in the morning or in the evening, and that can really help promote the strength in the glutes and help aid in that stability in that low back. So if you have any questions, like I said, please feel free to comment below if you have any questions, or give us a call. We're here to help, and I hope this was helpful. Have a great rest of the week.